Of support is definitely needed for any individual suffering from depression. This is especially important for men out there who usually hide their depression and never seek treatment. And here to talk more about how men deal with depression, we have psychiatrist Dr. Delvena Thomas here. And doctor, thank you so much for joining us this morning. This is a scary reality that we just saw there. But to talk about men dealing with depression, we heard about it in that piece there. We understand that women with depression are likely to attempt suicide more than men, but men are actually more likely to die from suicide. Yes. Why is that the case?
Well, because their means of attempting is more lethal. So they're using guns, they're trying to shoot themselves, they're hanging themselves. Women typically do things like overdose on pills or take pills.
And this is something serious that we need to start paying more attention to.
We have to. Major depression is the leading mental health disorder in the United States. It's the most common reason for poor health, disability worldwide. Over 300 million people worldwide have depression, and we know that in the United States, over 6 million men have depression, and they go untreated.
6 million men. So talk about some of the symptoms out there that we need to look out for if my husband may be suffering from depression, my son may be suffering from depression, or a family member. What do I need to look out for?
So we've had plenty of people come forward and share their stories, celebrities like Run DMC, Kendrick Lamar, Wayne Brady, also, just so many athletes and celebrities. We have to look for certain signs, such as in men, they don't cry, they don't look sad. So it won't be the typical symptoms we see in women because that's a feminine thing to do. Instead, they're angry, they're irritable, they're on edge. They also have physical manifestations such as achiness, they may have headaches, they have migraines, they have digestive problems. But what we do see in men is the same as women: sleeping problems, appetite issues such as, eating too much or not eating enough, distractibility, poor concentration, isolation, and the most severe symptom, suicidal ideation, thoughts about not waking up, thoughts about killing themselves or dying.
How do I know if I'm a man out there, how do I know that I may be suffering from depression? I may not realize it. So how do I know? How do I know that, maybe I need to get some help?
Yes. So, and that's a question people ask because there's different factors like genetic, environmental, illnesses that can make someone more at risk for depressive disorder. And so the way that people know is you notice a change in your performance. Maybe at work your performance is lackluster, it's not the same. At home you're not performing the same. And most commonly in men, they say that their libido decreases. They don't feel as being as romantic or as sexual with their wives. So that's something we see a lot also in men.
Wow. And I was shocked by some of the pictures of some of the celebrities you just showed, you talked about. Some of those, The Rock, Wayne Brady,
yes.
Run from Run DMC.
Yep.
I was shocked by seeing that. These are celebrities, but they're everyday people like we are.
They are, and they have brains like we do, and their brains go through different traumas and experiences. Run DMC, when he talks about his depression, he just gives so many details and specifics about how he suffered for so long and then self-medicated with alcohol. So these are things that happen to everyone. There's no, your income, how much money you make, your nationality, nothing will exclude you from depression.
Now, I want to go back over the symptoms that you mentioned before because you talked about some of those symptoms, but also there's anger, irritability, or aggressiveness,
yes,
as one of them, feeling anxious.
Yes.
You talked about some of those, and we're going to show some of those on the screen because you may be at home, you may be going through this, or you may know someone who is. So we're going to try to show some of those on the screen here so you could take a look at them. Also, you talked about feeling sad, empty, flat, or hopeless out there, and here they are on the screen here. But these are just some of the symptoms that we need to look out for.
Yes, absolutely. Everyone presents a different way, and as I said before, men can present differently from women. That's that anger, that irritability, feeling on edge, those physical manifestations, those symptoms. Men typically present different than women, so we have to be cognizant that if there's a change, if your husband, if your son, if your brother, if they appear differently to you, if they're acting different, then you should inquire, you should show concern, you should ask them if things are okay.
And let's talk about ways to help, because do I take medication for it if I'm suffering from depression, or is it something that I can just talk about with someone?
Jawan, you know, I always say we have to be proactive and not reactive, right? So we have to do the things in the beginning that will decrease the likelihood that we'll develop depression, like establishing routines in our lives. And these routines have to include healthy habits like getting enough sleep, having a good diet. We have to have a social support network of friends and family who we can turn to and we can vent to. We also have to do things like exercise and be physical. Those are some of the simple things we can do, but also seeking care, going to see the doctor. Men don't like to go to the doctor.
No.
Not for, not, you know, let alone mental, but for physical health problems also. So going to the doctor, just getting regular checkups. We can encourage one another to do those things, encourage each other to go to the doctor, take medication if that's what is needed for your depression. But there's also other ways to treat it besides medication.
You also mentioned spending time with other people and talking with a friend or relative about your feelings.
Right, yes. Being able to communicate. That's why it's important to have friends and family who you can talk to. You got to have that circle of support. I always say that there's different layers. That innermost layer should be the layer that you can talk to without feeling they're judging you. You don't want someone who will tell you, get over it, it's okay, you're not feeling that way. So we have to be mindful of that too. We can't say things like that to people to get over it and tell them what they're feeling. We have to be very understanding and be a listening ear.
You mentioned something here. You talked about, Ron, you were talking about alcoholism and how some people like to self-medicate and they use alcohol in order to do that. But you say avoid alcohol.
Absolutely.
Avoid alcohol.
Yes. See, what people don't know is that alcohol can actually cause depression or lead to symptoms that feel like depression because it's a depressant. It tranquilizes us. It sedates us. So avoid alcohol if you're already feeling down or if you're already feeling sad or depressed.
Yeah, because a lot of people think, hey, I'm going to feel good for a minute.
Right.
Yeah.
Yep. And when that euphoria wears off from feeling that high or feeling sort of that intoxicated effect, you're back where you started. The problem is still there. Yes.
And even worse,
even
I'm sure.
Worse.
Why is it so many? Why are we seeing numbers? It seems like the numbers may be increasing, but I don't know if it's because maybe we didn't keep stats like we did before, but why does it seem that the number is increasing, especially with black males?
I think there's a lot of factors. Number one, people are becoming a little more comfortable talking about what they feel because we're trying to destigmatize mental illness in our country. We want people to feel like talking about it. The other thing is education. People are being educated, they're reading, there's a lot of stuff out there on social media, on the internet, and now they're realizing, oh wait, I did feel that way, maybe I did have depression. So I think the other thing is that people now acknowledge that what they felt wasn't normal. I'm
disturbed by what I saw in the piece that ran before our interview and the fact that we're talking about kids, we're talking about young kids, males, young men and women, 5 years old. I saw 5 suffering from depression at the age of 5. So when I hear of a child committing suicide that may be 8 or 9 or 10, it's disturbing.
It's pretty profound. And I want you to know that study wasn't just a study over 2 weeks. That was a longitudinal study that was over several years. And they were able to determine, the CDC has the information that more black children, mainly boys, are committing suicide more than ever before. And when we talk about what the factors could be that's causing that, you know, of course some people say economics, such as growing up in a home where you don't have parents there or finances not being there, not having the support. But the key thing is access to care, because see, in the black community, we say that you don't need mental health treatment, you need Jesus, right? Go to church. There's nothing wrong with you. And then you know, it's compounded by the fact that we don't have enough mental health professionals who look like those children, so they're not comfortable going and talking to someone because they don't look like them. We need more mental health professionals who look like those children.
Amen. And I have an important question, and that's insurance. So what about insurance? Will insurance cover for me to go see a therapist like yourself to get that type of treatment?
Our former U.S. president made it possible for people to access mental health care without seeking a referral from a primary care physician. That means you can go directly to a psychiatrist or a therapist like a psychologist, a licensed clinical social worker, a licensed mental health counselor. You can use your insurance and go directly to a mental health professional without going to see anyone else first. And those plans they're required to provide some sort of mental health care or coverage. And I'll tell you, in my practice, all the plans have some sort of outpatient, meaning in the office care.
Okay, Dr. Delvena Thomas, thank you so much. A wealth of information and knowledge there. Of course, we're going to have you back on to talk about more of the issues impacting our community. Thank you so much.
You're welcome.
And if you'd like to reach out to Dr. Delvena, you can check out her website at drdelvena.help or call her office at 305-981-1700. And if you are dealing with depression or suicidal thoughts out there, call the 24-hour hotline of the National Suicide Prevention Lifeline at 1-800-273-TALK. And for veterans, call the Veterans Crisis Line at 1-800-273-8255.